Okay, you're back rolling.
Okay. Oh, me?
Yeah, so what do you,
Okay.
so the cat owners, so you talked about the fact that sometimes you're able to give some advice over the phone.
Yeah.
How compliant are cat owners with doing things at home? Because they only come once, twice
Sure.
a year. The rest of the time they're at home.
Yeah, no, it's hard. It's hard because there's a I think a spectrum of cat owners. You have ones that look at cats as, they're just cats, they just hang out. And then you have the others that are like, cats are awesome, they're so cool, they have great personalities. And those are the clients that you can kind of get to and really get them to understand and do some of those things. The cat carrier at home is a funny thing because I don't want that out of my house. I don't want that sitting out all the time, and it's ugly. But that is a really great way to get them used to it. But you do have there is a lot of pushback, and I think it's just lack of understanding. So we try really hard to explain those things, but it can be very difficult to get clients to kind of get on board with some of those things. I'm sorry, I don't know. That doesn't really help you. That doesn't really answer your question, I guess.
No, it does. You had some great comments in there because I think this is something, again, you're talking about client pushback. There's practice owner and practice team member pushback because they experience these things all the time, and nobody likes to recommend something that they know will work and then have people turn them down. It can be very frustrating.
Yes.
What have you done in the 11 years, what have you done with cat owners that you've noticed helps maybe some of those cat owners who, is there anything you've been able to do to get cat owners who didn't see the great personalities in their cats, who didn't see how fearful their cats were, to kind of turn their stuff around at home? Is there any ways you've learned to do that better in communicating with them?
I think in general, just the length of time working here it gives me that desire to want to do that more. I think that's me though. As I've gained confidence, as I've gained knowledge, I think it's a lot easier to have those conversations with people. It really falls on them for wanting to hear it and wanting to embrace it. And I think using my own personal experiences has been the best way to get through to those clients because I do have cats and I do have difficult cats sometimes that don't want to come in. So I use a lot of personal experience with what I've dealt with to try to get through those clients, to try to be on their, I understand what you're dealing with because I deal with it too. So that's for me the best thing that I can do with clients is use my own personal experiences.
Another criticism or worry that practice owners and team members have about Fear Free is that they think the things they do prevent bites and scratches and danger in the exam room. So to kind of ease into these things and not immediately muzzle a fractious cat or a fractious dog. Mm-hmm. This is dangerous for everyone. It's a dangerous animal that needs to be, we'll do this as quick as possible and get them home because there's no way to fix this. Yeah. Have you seen those, how do you respond to people if somebody came to you with that worry? I think it's too dangerous to try this.
Like an employee would come?
Absolutely,
yeah.
Right.
I think there is that point where you have to stop. I mean, that does happen, and that's okay. But I think what I always suggest to people is, well, maybe we should try a towel, or maybe we can go into a different room, somewhere where it's quiet, change the scenery. Just trying to give other options before we just give up, or we can't draw the blood out of the neck, so maybe we should try a back leg, cover the eyes. Wrap in a burrito for kitties. There are lots of things that we can try, even if it is a fractious cat. But there is sometimes that point where you do have to stop because it's not in the best interest of the pet. They do get too stressed out. And so we just try, go slow, take a break. Those kinds of things would be what I would say to an employee that would push back.
What were you surprised? You mentioned that you had a behavior person come in here who'd been through the Karen Pryor
school,
Emily.
Mm-hmm.
And she presented kind of education CE on low stress restraint, low stress handling,
mm-hmm.
and signs of stress. Was there anything in there that really surprised you? Because you've probably been in the practice for years already. Mm-hmm. Was there anything she taught you in that CE that you're like, I didn't know cats or dogs were stressed when they were doing that?
There were a couple of the warning signs for dogs that I think were eye-opening for all of us, but me especially, again, because I'm kind of a cat person, so the dog stuff, I don't interact with a dog at home, so that for me was like, oh, I've seen a dog do that, and that makes sense now, kind of thing. So yeah, it was really great to see. She had handouts and examples of the body language, and so for me, the dog part was the most beneficial.
Can you think of you might not be able to.